How is cancer treated? Main method of cancer treatment. Interesting about science and medicine, prepared by editors of a page or Scientifica. Nowadays, cancer is the most serious health disorder. In developed countries, cancer is the second leading cause of death after cardiovascular disease. Cancer as a disease is characterized by chaotic and continuous development of abnormal cells from a single cell that has become cancerous. Cancer cells no longer respond to the rules and signals of a body, which upsets its balance. If left untreated, the tumor expands and destroys other healthy neighboring tissue and spreads to other organs, metastasis. In this situation, cancer is considered to have become generalized. The search for new type of treatment for the disease continue. Already now, new treatment methods such as immunotherapy and gene therapy help improve classical type of cancer treatment, chemotherapy, radiotherapy, hormonal therapy, surgery, which will increase the change against oncological disorder. Cancer treatment in most cases do not consist of only one therapy. Typically, the oncologist arsenal includes the following type of treatment: chemotherapy, immunotherapy, surgery, hormonal therapy, radiotherapy. Radiotherapy and surgery are used for local treatment. Hormonal therapy and chemotherapy are used to prevent or treat generalized cancer. Their effects are seen through the body. Of course, the choice of treatment types depend on the type of cancer, but also on the general condition and age of patient. Surgery may be necessary at the beginning of a disease in order to confirm the diagnosis. It can be used to study cancer lesions and their expansion. In the case of localized cancer, surgery allows for the complete or partial removal of an affected organ or tumor. Radiotherapy is a method of treating oncological disease. This method of treating cancer uses radiation which make changes at the level of a tissue through which the ray passes. As a result, cancer cells are destroyed instantly or gradually. The problem is the radiation can affect nearby healthy tissue. For this reason, the use of radiation is limited. The type of radiation used and its dosage depend on the type of cancer. How does cancer chemotherapy consist of? Cancer chemotherapy involves various drugs that are usually administered intravenously. This way, the active chemicals are distributed through the body. Chemotherapy attacks both the visible signals of the cancer and the invisible or harder to notice on. A side effect of chemotherapy is that it not only causes the destruction of cancer cells but also affects the condition of healthy cells. Chemotherapy is especially harmful to cells that are renewed very quickly, such as bone marrow cells. How does hormone therapy work in cancer treatment? Hormone treatment of hormone-dependent cancers, breast cancer or prostate cancer, consists of limiting cancer cells in the hormones that they use to multiply. These hormones signal cancer cells to multiply, allowing the tumor to develop. By eliminating the place where these hormones are synthesized, ovarian testicles, or by blocking the signal for multiplication, the rate of tumor development is reduced. How does immunotherapy work for cancer? Immunotherapy consists of using substances that stimulate immune system cells to destroy cancer cells. So far, the use of this type of treatment remains limited to certain type of cancer. Gene therapy is a promising method for treating cancer. Gene therapy uses gene as a medicine. To be more specific, the gene responsible for the appearance and development of cancer in a normal situation are replaced. But for now, this therapy is at the development stage. How to detect cancer in time? The mechanisms of emergence and appearance of abnormal cancer cells are numerous and complex. They differ both in time and for each form of a disease. Thanks to advances in medicine, these mechanisms are becoming more understandable, which improve prevention and diagnostic methods and make treatment more effective. Prevention of cancer depends primarily on each person. 80% of all types of cancer arise directly from the patient's life and behavior. What measures should be taken to reduce the likelihood of cancer? Every person can reduce their own risk by avoiding such contributing factors: smoking, alcohol abuse, poor nutrition, long-term and repeated exposure to solar radiation. Factors such as heredity and environment have very little effect on the development of cancer. How to increase the change of successful treatment of cancer? In any case, you should pay attention to the first signs of a disease, which are signals. Accurate diagnosis of a disease consists of consulting a doctor and conducting some examination that can identify precancerous disorders, as well as tumor in the early stage. With the patient's change of successful treatment increase, a more detailed description of a cancer allows a patient to better understand the causes, symptoms, and evolution of a disease, which help to identify the disease early. Thank you for your attention. This material was prepared based on the page of Scientific. Attention, this material is for informational purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.